And the winner of our very first Daisy Award is Sister Marisa Joseph. Marisa Joseph, a nurse employed at the Georgetown Public Hospital, was the first recipient of the Daisy Foundation Award from the program that awards and celebrates nurses for their extraordinary clinical skills and compassionate care. It was launched here last December by the foundation, which is based in the United States of America. The awards ceremony was held at the hospital on Thursday. After accepting her award, Nurse Joseph said that she has always wanted to become a nurse.
My mother has 2 girls, and she said she wanted a nurse and a teacher. Ironically, my sister was the one nominated to be a nurse and myself a teacher, but it was in the reverse as we grew older. I came into nursing in 2009, and I knew that this was it. And I often ask myself, if it is I were to do something, it's what it would have been. And in every lifetime, I think I would be a nurse. Lots of times when I think that I'm not doing enough, it is expressed through my patients that, you know what, Nurse Joseph, they look forward for me coming to work. They would ask, okay, what's your schedule? When are you going to work again? And I try to be as empathetic and be the best version of myself as a nurse daily, because I know what it is to be in the hospital, and I know what it is to need and be dependent on that care from a nurse. So it's important that I do that.
The Daisy Award brings the strenuous work that nurses perform daily to the forefront. The nurses at the hospital are selected by patients and their families to receive the award.
I look forward to see my patients get better and go home. And we recently had a patient we had a talk with the relatives whereby letting them know there's a possibility that he would not have made it. But he's home and he is doing better. And those are the little things that I work towards.
Giving congratulatory remarks to Nurse Joseph, the hospital's Chief Executive Officer, Robbie Rambaran, said that the award program should be an inspiration for nurses to strive to give the best care possible.
As I often say, that most times when our patient comes here, they don't come because they want to. They come at the most vulnerable of time. And sometimes compassion and empathy will go a very, very far way. Being around, sometimes you hear about a good nurse and a good doctor, but when you hear those stories, it is not necessarily because of their clinical or medical practice, but it's sometimes the way that they communicate to people, that they form this base of conclusion that they are good nurses and doctors.
The foundation was formed by the family of J. Patrick Barnes, who died of an immune-attacking disease. His family recognized the service offered by his nurses as he was in the hospital and decided to honor both Patrick and the nurses. I am Lazina Yearwood reporting from the Georgetown Public Hospital.